Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB.
Hey. Good morning. We'll call Senate Health and Human Services meeting to order. And this is the last day for us. We have 2 Senate bills today, and the Senate bills will be cleared from our calendar. I want to welcome everybody online, everybody in the room, and those maybe watching the streaming now, the new service that we have. So I'd like to remind everyone to please silence your cell phones so we don't have any distractions there. And we're going to jump right in here and ask the Secretary to call the roll.
Senator Grove.
Here.
Perry.
Here.
Reed.
Here.
Smith.
Here.
Voigt.
Here.
Davis, excused. Jensen.
Here.
Mr. Chair, we have a quorum.
Okay, thank you. Could I entertain a motion to approve the minutes from the previous meeting? Senator Perry moves approve the minutes, seconded by Senator Voigt. All those in favor say aye. Aye. Opposed, nay. Okay, minutes are approved. So I want to remind everybody again, all testifiers, lobbyists, you've heard this over and over. Please have your proper credentials when you come up to testify. If you're here as an individual testifying, we'll make sure that everybody signs in at the podium up here on the iPad, or you can use your cell phone, use the QR code to sign in. And then I'll also remind anybody, if you have information or to hand any handouts at all, please give those to the pages. And I guess with that, I'll ask the pages to come forward and introduce themselves. Pardon me? Yep. Yep.
I'm Lee Decker. I'm from Rapid City, and I go to Stevens High School.
Any future plans?
I plan on going to law school after I graduate.
I'm Richard Carlson. I'm from Harrisburg High School, and I plan to go to USD for secondary English education.
Okay, thank you. So we're going to start with allowing 15 minutes pro and opponent. We'll be a little flexible with that if we need a little bit more time, depending on how many testifiers we have. We just have the two bills today, but we do need to dispose both of them. Senator Perry.
A quick personal privilege.
Absolutely.
If the two people in the green jacket could just walk up to the mic, it's unusual, but tell us who you are and what you're representing, because I think it's pretty exciting. That's the mic. You push the button and it'll turn green.
I'm Jackson Kamak. I'm from Sturgis, South Dakota, and I'm a 4-H state ambassador.
My name is Bailey Bender. I am from Britton Hecla, and I am also a 4-H state ambassador.
Okay, thank you. Thank you, Senator Perry, for that. I know you're both, as ambassadors, you're more than prepared to do impromptu speeches. I was a 4-H leader for a long time. So anyway, with that, we will get into the bill log here, and we'll start with Senate Bill 211, prohibit certain billing practices by ambulance service providers and establish reimbursement standards for out-of-network emergency medical services. Do we have any proponent testimony? Good morning.
Good morning, Mr. Chair, committee members, Tim Reed, District 7. And the first order of business, I would appreciate if you would move Amendment E, 211E.
Thank you. Senator Perry moves to approve Amendment E, seconded by Senator Smith. All those in favor say aye. Aye. Opposed, nay. Thank you. You may present 211E.
Thank you, Mr. Chair and committee members. When a South Dakotan calls 911, no one asks whether the ambulance is in network. They expect that help will arrive, that care will be delivered, and that the system will work. The reality is that many of our ambulance services, particularly in rural and frontier communities, are operating under significant financial strain. Rising equipment costs, workforce shortages, and inconsistent insurance reimbursements are putting real pressure on a system that we all depend on. When ambulance services are not reimbursed at a rate that reflects the actual cost of providing care, those costs do not disappear. They are shifted to local communities, counties, cities, and ultimately property taxpayers are forced to fill the backlog and keep ambulances on the road. This is not a sustainable funding model. And that is why I brought Senate Bill 211 and to walk through kind of the main components of it. Section 4 is really kind of the heart of the bill. And this says that a health benefit plan must reimburse an out-of-network ambulance service provider for emergency medical services at a rate not less than the rate established, adopted, or recognized by the political subdivision from which the transport originated. And if no local rate has been established, adopted, or recognized, the reimbursement rate must be the lesser of the provider's billed charge, or 275% of the Medicaid allowable rate for the same service. And that's a number that probably saw there was two different amendments out there in discussions. We thought maybe 275 was the right number. And then also, a health benefit plan shall provide the reimbursement for emergency medical services rendered on an out-of-network basis directly to the ambulance service provider, in accordance with provisions set forward in Chapter 5812, unless otherwise agreed in writing by the plan and the provider. The other major section of this is adding in the No Surprise Act. And that is, each ambulance service provider and health benefit plan shall furnish to a patient a clear and concise explanation of benefits and a statement of any amount owed by the patient. But also, with the exception of non-covered services, a patient is not liable for any amount charged beyond the applicable coinsurance, copayment, or deductible required by the patient's health benefit plan for emergency ambulance services. Senate Bill 211 establishes a clear reimbursement standard for emergency ambulance services. It requires health benefit plans to reimburse out-of-network emergency transports at locally established rates or at a reasonable Medicaid-based benchmark when no local rate exists. It also requires timely payment directly to the provider. If we expect EMS to be there for our communities in their moment of need, we must ensure that funding structure behind that system is stable and sustainable. I respectfully ask for your consideration and support of Senate Bill 211, and I'll stand by for questions. Thank you.
Thank you. Do we have any other proponent testimony? Good morning.
Morning, Mr. Chairman, members of the committee. Maynard Konechny from Kimball, representing the South Dakota EMS Association. We're 100% behind this, and the only comment I'm going to make is that there are 18 states that have this in law now, and they go clear up to 400% of that amount that Senator Reed talked about. And I'm going to turn over the testimony to those that deal with the insurance on a daily basis, and I'll stand by for any questions if you have them. Thank you.
Thank you. Any other proponent testimony? Good morning.
Good morning. Thank you for having us, and thank you for hearing this bill. My name is Brian Hambeck. I'm the Executive Director of Spearfish Ambulance and President of the South Dakota Ambulance Association. Cities and county leaders rely on ground ambulances. We've already talked about this. I've been in front of this committee several times and talked that sustainability is a matter of not just workforce, but finances. If you don't have the finances, you don't have the workforce. And since the pandemic, we have lost probably 30% of our volunteers. I had to go to full-time out in Spearfish. That means my costs are through the roof. However, insurance companies aren't keeping up with payments on that. Patients, in this bill, patients are protected from the No Surprise Act, which means we will not balance bill other than the coinsurance and deductibles. But in order for that to happen, the insurance payment has to be reasonable. Let me see here. Senator Reed already discussed pretty much a lot of this that we're doing. Just on a note here, when it comes to the financing, I talked last time I was here that we've got Medicare is one piece of that puzzle, Medicaid is another. And South Dakota Medicaid really stepped up their act about 3 years ago, and I am very thankful to Matthew Ballard and them for doing that. Medicare did a cost data analysis. I've talked about that before. They're only paying 55% of what it costs me to roll tires out the door. 55%. I don't know of any business that can accept 55% and stay open. So the other part of this is other payments, such as private health insurance, VA, HMOs. Now, VA they have to pay 100% of our bills. That has been federally legislated. However, the private insurances, and I'll just speak to one in particular, and that's Blue Cross. I know they're fighting this. They have not raised their reimbursement rates with us, and we're going on year number 6. And yet my costs keep going up every year. And my personal premiums with them keep going up every year. But we are not seeing an increase in what they're paying to our patients. We're just asking for a fair payment to our patients on this. I get calls pretty much every week from patients saying, why are you billing this extra? Because your insurance didn't pay it. And that's quite a strain out of their pocket. 2 years ago, we had a car accident on I-90. Husband, wife, and 2 kids wrecked their car. We ended up having to transport all 4 of them, and United Healthcare was their insurer. They paid for the wife's transport, and none of the other 3. They denied all of them. So I still had to send 2 crews and pay for gas and pay for the rig costs and medical supplies and all of that just to get denied. That's not fair to our patients. Not fair at all. So I know that Senate Ways and Means in Washington did a interview with 5 of the big healthcare systems. It was quite interesting. You can watch it on C-SPAN on YouTube. They all recognize the treatment in place, and we've talked about this as well, would save health insurance companies money. They all agreed that reimbursement rates are not where they should be. And so I just ask that we consider this bill and pass this bill to help our local agencies and to help our patients. With that, I will stand by for any questions.
Thank you. Do we have any other proponent testimony? Good morning.
Good morning. My name is Nicole Hannon. I serve as the Director of Operations for Patient Care EMS out of Sioux Falls, South Dakota. It's an honor and privilege to be here with you this morning. I'm born and raised right here in South Dakota, and I've spent my entire life here, and I'm happy to say that my kids now get to enjoy the same parts of this state that I have all of my life. You'll see that we bring a crowd. However, this is a very small portion of the volunteers who serve throughout our state and those in career EMS who work as first responders, paramedics, EMTs, all throughout our state. As it's been shared, a lot of that is done on a volunteer basis and without always having the reimbursement that we need. The sustainability of EMS throughout our state is a very highly discussed topic lately. It's been brought to you guys within the legislature the last couple of years and will likely continue to be a talking point that you see in the coming years as we address what it looks like. We are at a pivotal juncture in EMS. We are at a place that affords us an opportunity to reevaluate our system organization and truly identify ways that we can best serve to save the lives of those within our state and save our ambulance services from shuttering their doors. While employment, volunteerism, training, and other factors remain critical in our future success, none is as high as the concern for reimbursement. We've tossed around the term essential service as if a magic wand waves and funding appears for it. We all know that that's not the way that happens. We've evaluated things like ambulance districts, and we've evaluated things such as subsidies and other potential options, even at times questioning what we're going to do if something doesn't change and no one can come when 911 is called. Senate Bill 211, as presented to you today, gives us a different way to look at reimbursement that is what's best for your taxpayers and our patients. Senate Bill 211 at its heart is a Patient Protection Act. It is a bill that aims to ensure that patients are protected from unfair billing practices, such as balance billing, and that insurance companies who are currently reporting record profits properly support their insured customers with adequate coverage of emergency care when they are out of network. But what does any of that mean? All of us here in South Dakota love to travel. When I am planning a summer vacation, one of the places my children love to go is to the Black Hills. As we load up our vehicle and we travel across the state, I trust and I know that the ambulance services are going to be able to take care of us when tragedy strikes. What happens on the backside, though, is if something does happen, let's say we load up from Sioux Falls, we get to about Kadoka, and a tire blows and our vehicle rolls. I have 6 children, and my husband and I in that vehicle potentially. That's a lot of burden for unreimbursed if my insurance doesn't cover it all. And so now not only do we have potential time lost of work, we have the cost of replacing a vehicle, we have the cost of getting home and taking care of rehab or anything else from that accident, but then I get a bill that says my insurance only paid a very small portion because the ambulance service was out of network. And now I have to try to figure out how to take care of that too. Senate Bill 211 allows us the ability as ambulance services to ensure that we can continue to respond and that our patients can continue to be cared for without that fear on the backside. Ambulance services, as we've mentioned, are carved out of that No Surprises Act. That means we are allowed to balance bill. If your insurance company doesn't pay, even though you've paid your premium faithfully, the bill can come to you for the rest. This can cause an undue hardship to patients. Unfortunately, services that elect not to take practice in this unethical billing practice are left to figure out how to supplement the remaining cost, oftentimes writing it off. This creates a deficit in revenue for us, which renders us unable to continue serving in the areas that we are at. The second part of Senate Bill 211 really focuses in on this idea of EMS sustainability. The idea that the taxpayers in a certain municipality should be the ones to carry the burden of that full bill seems like a hard one to me when there are other players that could come to the table to help. The average cost of ground ambulance transport within the state of South Dakota, based off of a recent study, is about $2,400. The current Medicare reimbursement for that is right at $1,000, leaving about a $1,400 bill on average to each patient. Taxpayers, when we start talking through how we subsidize or how we create an essential service, that $1,400 is what we have to come up with. It shouldn't fall just to the burden of the taxpayers to have to do that. It could also come partly from the insurance companies that are covering our patients. In conclusion, I want to take a minute just to tell you thank you for the work that you do. Thank you for being here. Thank you for the time and effort that you put into looking into this and to taking care of our great state. I hope that we will have your support as we move forward with this bill. We've come to the table with the representatives from insurance companies and been willing to negotiate what percentage exists. As my friend Maynard said, 17 states have adopted this, many of them at a much higher percentage. We feel this is an appropriate percentage for the state of South Dakota for all parties involved, and we hope that you'll support that with us. I am available for questions.
Yeah, thank you. We have a couple of minutes left. I know we probably have some more testimony, but we'll be a little flexible with that. So any other proponent testimony? At this point, we kind of ask to not repeat a lot of what's been said, but if you have additional information, that'd be wonderful. Thank you.
Yes, sir. I will be speedy for you guys today. Thank you, Senator and Chair. Nice to see everyone again. Brent Long, EMS Division Chief for Rapid City Fire Department. I appear here before you today in support of Senate Bill 211. Ground ambulance services are not a luxury. They are part of an essential public safety infrastructure, just like law enforcement and fire response. Our EMS crews are available 24 hours a day, 7 days a week, and we respond to people without asking first what their insurance network might be. Yet today, many ambulance services across South Dakota face a growing financial threat. Insurers routinely paying far below the true cost of our readiness, particularly when patients are transported for a out-of-network through no fault of their own. Senate Bill 211 helps fix that problem in two critical ways. It protects that patient from surprise balance bills that we've talked about, and it requires insurance to reimburse ambulance services at a fair and enforceable rate. Both protections must work together. If patients are shielded by insurers, or if patients are shielded and insurers are allowed to underpay, then the shortfall will end up being absorbed again by our local taxpayers, by our city and county general funds, or by hospital subsidies. And that's just unnecessary. This bill is very straightforward and practical. It prohibits ambulance providers from balance billing beyond a normal cost sharing, so that they're just responsible for the deductible, the copay, and their co-insurance. At the same time, Senate Bill 211 requires that out-of-network emergency transport insurers reimburse no less than our locally established rates. If no local rate exists, then the insurers must pay the lesser of that billed charge, or at the now 275% of a Medicare allowable. Why 275%? Medicare reimbursement is simply not calibrated for the realities of emergency ambulance care, especially in rural South Dakota. Rural readiness requires additional staffing, longer response times and distances, higher fuel costs, equipment costs, and around-the-clock availability. This multiple of Medicare is necessary to reflect those realities. and prevent insurers from exploiting the out-of-network loopholes to shift those costs back onto our local governments and our patients. Many of us in this room have spent a lot of time and have worked together, some of you even creating bills. We've been searching for potential funding sources and also attending that summer study that we did this last summer. Reimbursements for sustainability has been the center of most of these discussions. Senate Bill 211 helps bridge that gap for reimbursement and takes it off the state and local governments that already have a stressed tax base. Senate Bill 211 respects the local control. If the city or county sets an ambulance rate, insurers should honor those rates. That ensures communities, not just the insurance companies, define the cost of maintaining emergency readiness in our jurisdictions. To protect our taxpayers and strengthen oversight, this bill directs the Division of Insurance to maintain that public database of ambulance reimbursement rates that are submitted by the local jurisdictions. This helps create transparency, it fosters consistency across the state, and holds the insurers accountable. Senate Bill 211 requires insurers to pay clean claims within 30 days, prompt payment to protect EMS cash flow, stabilizing our payroll, and keeping ambulances fueled and staffed so they are ready to go when the next 911 call comes in. Supporting this bill means protecting residents from surprise bills, preventing insurance underpayment and cost shifting, strengthening both the rural and the urban EMS access. It helps to ensure local governments are not forced to subsidize shortfalls that rightfully belong to the insurers. Emergency medical services are not optional. They are essential infrastructure. Senate Bill 211 ensures that insurers pay their fair share so that our communities continue to answer the call. I'll urge you all to support that, and I'll be available. So.
Okay, thank you. Yeah, we did hit the 17-minute mark. If anybody else would like to come up and proponent, kind of offer a me too, yeah, just very briefly, please. So. Good morning.
Good morning. Thank you, Mr. Chair and members of the committee. My name is Travis Smith. I represent PCC and Ambulance Billing Service. We work right here in South Dakota, so we have a stake in this legislation just like everybody else. We work with over 225 ambulance services in 5 states, including about half of South Dakota ambulance services that currently run. Since our founding in 1999, the healthcare industry has changed dramatically, with the past 5 years being the most significant shifts. I'll skip and make things a little shorter, but basically most payers like UnitedHealthcare, Aetna, Cigna, all the national payers do not require you to be in network in order to receive payment for your ambulance transport. The only one I know of that really requires that is Wellmark Blue Cross Blue Shield. And if you are not in network, their policy says that they will pay the patient directly for your claim, and then the ambulance service is the one that gets to bill the patient directly. So the ambulance is on the hook to work out payment plan with the patient, and the patients generally don't have a whole lot of extra money if they're in a severe healthcare crisis. So they're the only ones that require you to be in network in order to receive payment. The treatment in place was kind of touched on. Medicare is a transport benefit only. Most commercial payers, most insurance companies follow that same rule. So if a diabetic patient were to have a diabetic emergency and you go out on scene and provide life-saving care, most insurance companies won't cover that. That is just considered out of pocket for the patient. These costs, obviously, we've heard before, everybody else speaking, that these costs are going up significantly each year, which basically puts the burden back on the patient to cover these types of transports or non-transports. So the surprise isn't necessarily from us. From our perspective is that we're billing the patients for these healthcare crises. The surprise is that healthcare isn't covering these medically necessary services. PCC obviously supports this legislation, and anything less than like a 3.3 times Medicare allowable is going to be detrimental to the healthcare industry, the ambulance industry in the state. So with that, I'll be around for any questions.
Okay, thank you. We've hit about the 20-minute mark, so we kind of went over there. Does anybody else want to come up and offer a me too and a proponents? Good morning.
Good morning, Mr. Chair, members of the committee. Tim Walberg, District 8 from Madison. I just want to offer a me too and just simply say a lot of you that are on this committee right now also sat on the summer study, and you know how financially strained ambulance services are. But I'm going to give you a different viewpoint. Also look at this as a good consumer protection for the patient. So we don't have to turn around and bill that patient for these services. Let's have the insurance companies take care of their job. Thank you.
Okay, thank you. And with that, we'll move on to opponent testimony. And I'll reset my timer. That was not my phone going off. It was my timer. So. Good morning.
Good morning, Mr. Chair, members of the committee. Dylan Wheeler here this morning on behalf of Sanford Health and Sanford Health Plan, here this morning in opposition to Senate Bill 211. But to be clear, we do support certain elements of the bill, which I can get into, but we do take an opposition stance on the bill. As an integrated health system and health plan, we do recognize that this unique policy does impact both health service delivery and health insurance. We do also understand the need for sustainable ground ambulance services for our patients and members, and also understand that health insurance affordability and healthcare affordability is front and center for many families, businesses, and individuals at this point in time. Ultimately, we do need to keep those patients and members central as we debate this policy. We do oppose Senate Bill 211 for the following reasons. It inserts itself in the private contract negotiations between entities. It sets a bad policy precedent in inserting a certain mandated reimbursement rate into a statutory code attaching to something at the federal level. And ultimately, this will have an impact on health insurance premiums for families, individuals, and small businesses in South Dakota. It will impact less than 25% of the health insurance market in South Dakota, and those families, individuals, and small businesses will be the ones that will shoulder the premium increase and cost impact of Senate Bill 211. Prior to getting into the details of opposition for Sanford Health, we do want to highlight and emphasize the good policy in this bill, the prohibition on balance billing for ground ambulance services. It's been referenced that that is a gap at the federal level of the No Surprises Act, and we fully support codifying that prohibition for balance billing at the state level. If the bill ended there, we would be in full support. And even if this bill fails, the practice of balance billing health plan members for ground ambulance services needs to end, regardless of this bill moving. That being said, we do have concerns about Section 4, which mandates reimbursement for ground ambulance providers who deliver services out of network. Key points of concern for Sanford Health and Sanford Health Plan of Section 4 include the first sentence. That first provision of Section 4 dictates that health insurance companies need to honor a local subdivision or local political subdivision's rate setting for ground ambulance services. In contrast to the sentences after it, Provision 1 does not have a cap on the reimbursement rate that a local political subdivision can set. So meaning that a local political subdivision could establish a rate higher than 275% of Medicare. Ultimately, too, health plans do not have contracts with local political subdivisions. We have contracts with providers. Having a non-party insert itself into that negotiation process and set a rate who is a non-party to that contract gives us additional concern. Additionally, health plans would be required to reimburse at, or mandate to reimburse at 275% or billed charges. What does this mean? And I've heard from proponents that perhaps this does not and would not have an impact on health insurance premiums. But when we see a bill such as this mandating 2- or 3-fold of reimbursement, I think I've heard from the good senator in explaining the bill, those costs do not disappear. They do not disappear for health insurance premiums either. Two things will occur. A health plan will either need to look at reducing benefits in other space to absorb that more reimbursement or additional costs, or they'll have to increase premiums. Those costs do not disappear. In our experience in having this bill up in North Dakota during a previous session, that bill did start at 400% of Medicare and did go down to 250% of Medicare. That rate of 250% of Medicare did have a 6-figure impact in premium to one of our largest clients up in North Dakota. For Sanford Health Plan, even at the 275% of Medicare on the high end, this bill could have a $500,000 impact to our organization or $200,000 on the low end. Why is there a high end and a low end? With this rate, the rate would be higher than if you were in network with a health insurance provider. There would be no incentive to stay in network with a health insurance provider. You would just go out of network to get that higher reimbursement rate. So we would anticipate that some of our existing in-network providers would go out of network to get that mandated higher reimbursement, thus a high-end range. If we were to get more folks in network and have a limited out of network, roughly at the 200,000 range. Finally, I do want to offer up Senate Bill 89, which was, again, another summer task force coming up this summer, where if there's a broader holistic reimbursement question going on and whether or not it should shift to the private market, would be happy to further engage during the summer as well. We recognize and again appreciate the services of our ground ambulance providers do for our patients and members. I agree with the folks that came before me. They serve them 24/7. But we have concerns with codifying that specified rate and the inability to control what a local political subdivision has. And finally, we do have concern on the health insurance premium impact of Senate Bill 211. Thank you, Mr. Chairman.
Thank you. Any other, excuse me, opponent testimony? Good morning, Ms. Clement.
Good morning, committee chairman, members of the committee. My name is Melissa Clayman, and I represent Wellmark Blue Cross and Blue Shield. I think you've heard my name a lot today, our name a lot today. I want to start with, we deeply appreciate the efforts to protect South Dakota families from unexpected medical costs and share your commitment to ensure that consumers are not subject to balance billing for emergency ambulance services. We do look for these solutions that serve consumers, but we do urge caution with Senate Bill 211, as its approach may inadvertently destabilize insurance markets and increase costs for everyone. As noted today, it's important to recognize that ground ambulance was excluded from the Federal No Surprises Act. A lot about what we talked about this week in this committee under Senate Bill 233, and looking for some state-level action. In those recent discussions, other legislative efforts we have consistently advocated for balanced reforms that protect consumers while preventing we want to prevent the stability of the insurance marketplace. So Senate Bill 211 does prohibit balance billing, an objective that we do support. I want to be clear on that. However, when the bill mandates, I think we're at 275% of Medicare rates for all ground ambulance services without setting any limit on what ambulance providers can bill or charge with no billing caps, we have concerns. And this approach guarantees different hyper payments and removes incentives for network participation. And we're going to talk a lot about network participation. The risk shifting, not controlling costs, and without limits on what ambulance companies can bill, consumers are ultimately going to see higher premiums. We talked about the tax burden that with these higher rates, well, premium payers are taxpayers as well. We want to protect consumers, again, from balance billing. We urge pursuit of a holistic solution, one that addresses the entire insurance market, not just a narrow subset. Narrow legislation will drive up premiums. So we look for this solution. One thing that was said to me in this Capitol today is, why doesn't everybody just go in-network? Why don't we mandate that everybody has to go in-network? I said, well, we can't do that. Network agreements are central to our current system's stability. Providers agree to fair payment rates and clear billing practices, safeguarding consumers, because that's who we're talking about, and keeping premiums in check. And when I asked my team to look at what we were talking about, I was told that 93% of the claims that we receive for ambulance are in network today. 93%. Mandating a payment rate of 275% over Medicare will increase coverage costs for South Dakotans. Insurance premiums reflect total claims costs, and higher reimbursement rates force premiums up for families and businesses. Moreover, setting private insurance payments far above Medicare risk is subsidizing government programs. It's an unstable approach. In closing, again, we shared the goal of eliminating surprise balance bills for ambulance services and protecting South Dakota families from unexpected costs. Senate Bill 211 is not ready. By setting an unsustainable high payment rate, removing incentives for in-network participation, and risking premium increases for every insured South Dakotan, this bill endangers the stability of our health market, and we respectfully ask you send this bill to the 41st day.
Okay, thank you. Any other opponent testimony? Good morning. Maybe your voice is a little stronger today.
I'm afraid to open my mouth now. Good morning, Mr. Chair, members of the Senate Health and Human Services Committee. My name is Darla Pullman Rogers, and I appear before you today wearing two hats. I'm a registered lobbyist for America's Health Insurance Plans. That's AHIP. AHIP is a national trade association of health insurance companies whose members provide health care coverage, services, and solutions to hundreds of millions of Americans. I'm also a registered lobbyist for the South Dakota chapter of the National Association of Insurance and Financial Advisors, which is a state trade association comprised of life and health insurance agents. NAIFA's agents service the insurance needs of clients across the state of South Dakota. AHIP and NAIFA both rise today in opposition to Senate Bill 211. And if I may, Mr. Chair, I would just like to provide comments on behalf of both. Many of the points that I was going to make today have already been made by other opponents, and so I will gloss over those. As the other opponents have said, we appreciate the efforts to prohibit patients from balanced billing if they receive service from out-of-network ground ambulance service providers, and we share the goals to provide critical consumer protection. Our concern is with utilization of an arbitrary and mandated payment methodology, which will lead to inflated costs to an already fiscally strained healthcare system. We believe that the goal of reimbursement methodologies should represent a reasonable, usual, and customary payment for services provided by non-participating ambulance service providers. A reimbursement methodology required in Senate Bill 211 based on billed charges and or 275% of the Medicare rate is not appropriate, and it runs counter to the goal of setting a reasonable and fair reimbursement rate for non-participating providers. And as has been pointed out by other opponents, this type of mandated inflated methodology will also encourage or disincentivize providers from contracting and being in network. I would also note that this bill is similar to another bill you recently considered in this committee, and we urged you as state government to focus on the overriding goal of promoting affordable health insurance for South Dakotans. We suggested that your goal is not to interfere in private contractual negotiations between providers and insureds. Your goal is not to set in statute inflated reimbursement rates. It is not to pick winners or losers or to weigh in on one side or another. It is not to incentivize providers to go out of network in order to receive higher reimbursement rates. Your overriding goal should be to help South Dakotans find affordable health insurance. I would also note that this is a slippery slope. How many providers will be in line to ask you to do the same thing? With regard to my NAIFA agents, I would just remind you that the agents focus on one thing, and that is affordability. Senate Bill 211 will increase the cost of insurance due to the inflated reimbursement rates for out-of-network ambulance providers. Those increased costs will be borne by the premium-paying people of South Dakota. South Dakotans are struggling now to find affordable health insurance, and imposing additional costly requirements on health insurance companies, such as those found in Senate Bill 211, exacerbates the affordability problem and moves the needle in the wrong direction. The premium-paying South Dakotans are your constituents. They are the individuals, the families, and the small businesses that live, work, and play in your local communities. And agents are the ones in the field who face your constituents every day, trying to assist them in finding affordable health insurance products. So when your constituents ask you, as their legislator, what are you doing to make health insurance premiums more affordable? How will you respond? I would suggest that passing Senate Bill 211 is not a good response to a growing need for more affordability in the health insurance marketplace. We appreciate the opportunity to provide input. I apologize again for my voice. Maybe one day it'll get better. But for all of the foregoing reasons, AHIP and NAFA of South Dakota urge you to defeat Senate Bill 211. Thank you.
Okay, thank you. I have time probably for one more opponent.
Good morning, Mr. Chair and members of the committee. I'm Kim Malson-Risen with Avera, and I'm speaking on behalf of our Avera Health Plan today and asking you to oppose Senate Bill 211. First of all, I want to state that we agree that EMS is a critical service in our state. We've been at the table for a lot of discussions over the years about how to shore up those services, make them financially viable, given the many challenges that we all know exist. We also agree that payments should be fair to providers so that they can continue to provide those critical services. I want to clear up a couple of things that we heard about this bill and make sure that we're very clear about what it does and what it doesn't do. Senate Bill 211 does not address the Medicare rate that exists for folks that have Medicare coverage that we heard proponents say was wholly inadequate. So this bill does not change the Medicare rate. That will still, be at the level that it's at right now. What it does do is ties private insurance rates to that Medicare rate. That is really, I think, something that we need to think a little bit further about. We've seen the rate of Medicare in this bill alone change from 325% to 300% as a potential amendment, and now at 275%. I think that shows that we've got more work to do to figure out really where should these rates be in the future so that they are fair to providers, fair to insurers, but just tying to a multiple of Medicare right now doesn't seem like the right approach. The other thing that we heard a little bit about from the proponents is something that, again, I think we should discuss more. Treatment in place. What happens when an ambulance goes out? They don't need to transfer the person to the emergency room. They can adequately serve that patient at the place that the ambulance meets them, but they're not getting paid today. I think that's a legitimate issue that needs to be sorted out. This bill does not cover that. So what this leaves is a lot of opportunity to still really look at some of these fundamental issues with EMS in our state. We feel that Senate Bill 89 that you all passed out of this committee, which passed the Senate floor, will create that task force to study EMS as an essential services and the funding thereof, is really a good vehicle to really look at these issues in more detail, get the right people together to really sort through what some of these numbers should look like, what some of these policies should look like. But at this point, Senate Bill 211 is not the solution to some of those issues. I would just end by saying if you pass Senate Bill 211, I think you can expect to participate in undermining network negotiations. The previous speaker just mentioned a bill that you talked about on Wednesday, and you chose not to do that in law. If you pass this bill, you would be changing kind of your policy in that regard. It would cause more providers to go out of network. We would be incentivizing providers to not participate in networks because of the pricing that's in this bill. It would increase insurance premiums. That's, I think, pretty straightforward. And finally, it would shift those financial burdens onto South Dakota consumers and employers. And so for these reasons, we respectfully ask that you send Senate Bill 211 to the 41st day. Let's rely on Senate Bill 89 to continue these discussions. Thank you.
Thank you. Any other opponents with a me too? because we have expended the time. Any other opponents? Seeing none, I'll allow time for rebuttal. Thank you.
Thank you, Mr. Chair. Tim Reed. Hey, one of the things that we keep talking about, what's reasonable and fair, and premium payments will go up. We're at a point where we're going to start losing ambulance services, right? They're unsustainable. We learned about that. And so the question here is, what is reasonable? What if a premium payment goes up, there's a complaint about that, but there's going to be a bigger complaint when that ambulance doesn't show up. It's an essential service. I mean, even though we haven't stated it in law, we all know when you dial 911, we want it to show up. Now, there's two parts of that being an essential service. Part of it is you got to have the rigs, you got to have the garage, you got to have the trained employees. But then you also have to roll that ambulance when it's needed. And there's a charge through all of that also. And so as we're looking at this holistically, what are we going to do? This is a good start. Now, we're talking about the amount of I keep saying Medicaid, Medicare, the percentage of Medicare from NCSL, the National Council of State Legislators, are showing that there's several of these bills, and the minimum reimbursement to prevent balanced billing is from $325 to $400 of the local Medicare ambulance fee schedule. Colorado's $325, Washington's $325, Texas is $325, West Virginia is $400. And so as you can see, the number that we set is lower than that. Now, there's a lot about, we want to make sure there's no balanced billing. Well, the only way you can get rid of balanced billing is to make sure that there's payment to the ambulance service. That's the only way we can avoid it. It's the only way we can avoid it. Also, as we start talking about just healthcare in general and premiums, and when a hospital or a major system, they look at their, what they get for different services reimbursement that they've negotiated, they have other places to make funds up. An ambulance service rolls an ambulance. That's what they do. And so you don't have that benefit of a large system. My fear here is if we don't figure out a way to make up for Medicare is lower than what it costs to roll an ambulance. And sometimes some of the negotiated rates and stuff can be lower than what it costs to roll. I mean, that's when they say we got to be responsible on premiums, we got to be responsible on health care. We still got to pay for what it costs to roll that ambulance. And so if we don't make up for that amount, we're going to continue to lose ambulance, or we're going to start to lose ambulance services. Yes, I think Senate Bill 89, if we can get it through the House, is going to be a great start. But I think this discussion about this bill is also an important start to try to figure this out. So I'd ask for your support with Senate Bill 211. Thank you.
Okay, thank you. With that, we'll open it up to committee questions.
Mr. Chair.
Senator Grove.
For the prime sponsor, Mr. Chair, I apologize. This is moving very slowly, so I can't pull the bill back open. But can you just reiterate? So there are several things that happen first before the 275% comes into play, correct? So you have several different entities that one could bill, and if those entities are not in play, then it's 275. Is that how that works? I'm sorry. Can you just say it again?
Mr. Chair, again, Tim Reed, District 7. No, it's actually not different. You don't build different organizations. It's how the rates are set, right? So there can be a local rate set, but if there is not, then the recognized reimbursement rate will be the provider's billed charge, the lesser of, one, the provider's billed charge, or two, this is where the 275% of Medicare allowable rate comes in.
Thank you. Any other questions from Senator Perry?
For the sponsor, Mr. Chair, Couple things when you were doing the rebuttal. 275 is low compared to some of the other places. Is there a plan for increasing that in the future? And are you starting here and going somewhere else?
Tim Reed, District 7. Thank you for the question, Senator. The amount was, as talked about, being arbitrary. But the point of it is, to what extent, as we're working with ambulance services, will it help them? We know they're in a difficult situation, but this gets it started. I do think as we get into the, hopefully it'll pass. We have to go through the House yet. When we have the new task force, we do have to look at this in the eyes of if it's an essential service, and what do people expect? And so there's two sides to me. It's what it rolls and what do people expect. And people expect that ambulance to be there when they call 911.
To go a little farther, have we lost services, and where were they?
Mr. Chair, I don't know of any that we've lost, but through the testimony, through our work, and there might be some, I'm here behind me.
Macintosh is closed just
Hey.
recently.
So Macintosh is one that has closed.
And there might be one or two other that are on the verge of.
Yeah, but that's what we learned in the committee, is that they're close. It has to do with a lot. That's what we really did through the committee work this last year. We learned about all the problems that there are, and there's some that funding helps, there's some that other things help with. But it's on the brink of losing these important services.
Any other questions from the committee?
Mr. Chair.
Senator Davis.
Thank you, Mr. Chair. For the sponsor, apologize for my late arrival here, so I apologize if you've already answered this question. We saw some similar legislation that you brought about continuing the work of the EMS task force, and you just kind of referenced a little bit in your previous answer. Is this something that could be worked on during that conversation?
Mr. Chair, definitely we could be working on this. I think this was a start to get these services help now. I think if we do decide that we're going to have an essential service, have it as an essential service, and how are we going to fund it, that will come a little bit later. But there is a holistic approach that we will need to take when it comes to how we fund ambulance services during that task force.
Mr. Chair,
Senator Grove.
can I ask another question? Brian, could I ask you a question? Mr. Chair. You stated in your testimony that you lost, I think you gave a percentage, or maybe you said 30 people. You lost quite a few people in 2020. And I was just wondering, why did you lose all of those people? What happened?
Mr. Chair, Brian Hambeck, Spearfish Ambulance Service. We lost 30% of our workforce. At that time, I relied on part-time or volunteer, as well as a couple of full-time. When the pandemic hit, they said, you know what, I don't want to deal with this day in and day out and take it home to my family, and they quit. They walked off. So I had to cover town. I had to hire full-time to make that happen. So during the pandemic, we were doing a lot of treatment in place, and we never saw a penny for that from any insurances. So.
Thank you. Any other questions? Senator Perry.
I'm not sure if I want to go to the proponent or opponent, but I think I'll go opponent, and I'll go Avera. And if you need to phone a friend, I'm happy with that. Here's my question is, why would any ambulance go into the network if this passes?
Mr. Chair, thank you for that question, Senator. I think that is a fundamental concern that we have with this, which aggravates kind of the negotiation process that we use to be able to have stable rates that are part of our premiums. And so we think that this bill does represent that risk that with this in place, there would be no incentive to stay in network. Folks would look to this.
Okay, thank you. Any other questions from the committee? Senator Voigt.
Thank you, Mr. Chair. If I could speak with the sponsor, please. Senator, this is a question regarding access to resources in terms of the cost of ambulance services, especially those that are volunteer. There is a funding opportunity, and the question is is it possible to access or to tap this in terms of the Rural Health Initiative?
Mr. Chair, I think, Senator, I think what's important to realize about the rural health care transformation grants is that it is, it's limited in time, and we're talking about being sustainable. Now, I think there's some things we can do with the grants to get us started that could save money for the ambulance services that would hopefully then pay for itself from the savings. But I think it's always a possibility, but I don't think it addresses the problem right now.
Follow up, if I could. Is my understanding what you just said is it addresses the issue currently, but not the reality of what needs to take place for sustainability?
I'm not sure if I'm following, Mr. Chair. I'm not sure if I'm 100% following what you're saying there, but I think we talk about there could be some short-term savings from rural health care transformation grants, but the question's always going to be, is it sustainable into the future?
Okay, thank you. Any other questions? Senator Perry.
For the chair, or for the prime sponsor there. Basically, I agree EMS is critical. 100% agree, and I know it is important. One of the things that was said is, I think by the opponent, is that 93% of ambulance services are now in network. So we're addressing something that's for the other 7%, is that correct?
Mr. Chair, we are addressing an issue that there are that we're ending up billing, I should say we, but the ambulance services are ending up billing the patient when they're out of service. And so that's the issue that's happening here. And then your ambulances or your services are not able necessarily to collect all of those funds. And you heard in the testimony that at times some insurance companies pay the individual directly. And so then the ambulance services are left to actually collect the funds. So while we're talking maybe about a small percentage, it's still causing quite a bit of trouble for the ambulance services in their financial stability.
Okay, thank you. Any other questions from the committee?
Follow-up. One last follow-up. Regarding the conversation that just occurred, volunteer ambulance services are notified of a billing to a patient because they don't have coverage. So then that department or entity has to come up with resources to take care of that, which impacts their other services or the possibilities or the quality that they are also responsible for in that community. Is that correct?
I'm going to phone a friend, Mr. Chair.
Brian Hambeck, Spearfish Ambulance. Mr. Chairman, I'm sorry, sir, could you rephrase the question?
If I could. Volunteer Fire Department has several responsibilities. One of them is first responders. And they make a call and follow up. And eventually they receive a notice that there is consideration for those services that were provided by that entity. And the reality of it is those expenses are not budgeted for, but the department is then responsible for securing that funds from those patients that receive that service. So now we become a collection agency. And that's not what the volunteer entity was there for, as a collection agency.
Volunteer or full-time, it doesn't matter. We have to respond 24 hours a day, 7 days a week, whether the patient has insurance or not. It's the ones that have insurance that the insurance company may pay for or they may not. Then we are left holding the bag and have to go after them in court or through small claims, whatever. As far as premium increases and that type of thing, if I can address that real quick, I have a Blue Cross policy. My premiums go up every year. Last year they went up $300 a month. So by saying that they have to jack up the prices on their premiums, it's just not true. So, any other questions, sir?
Thank you.
Thank you.
Okay. I think we probably run the clock pretty well on this one. I think I'll close questioning and open it up to committee action and or discussion.
Mr. Chair.
Senator Davis.
I would move Senate Bill 211 to the 41st day.
Senator Davis moves Senate Bill 211E as amended to the 41st day. Senator Perry seconds. Any discussion on that?
Yes, thanks, Mr. Chair. Well, my EMS friends in the room know that I've gone to bat for them many times, and I greatly appreciate their service and know how critical they are to our communities. I'm also really familiar with the out-of-network problems insurance brings to the table, not just in this area, but a lot of areas of healthcare. And I'm no stranger to those issues and how problematic it is. The reason I'm making the motion, though, is because of that knowledge that I have, I know it's not as simple as the fix is not as easy as we want it to be. And so I am comfortable making this motion because I know that the summer study that will happen this summer, hopefully, we've already approved it in the Senate, moves on to the House, is going to specifically look at funding for our EMS and how do we keep it sustainable and really going to encompass all of those really hard questions. And so I appreciate the good senator that brought this bill. I know he is working tirelessly to try to help answer those questions. And so I'm confident that he's going to continue that great work. And so that's why I made the motion. It's not because I don't believe this is a problem. It's just because I don't know that this is the solution.
Other comments?
I agree 100% with the vice chair. Her assessment is correct. And this is one of those discussions that we went to before when we were saying, should government be involved in private business rates? And so that's the reason I seconded it. But there is one thing I'd like to comment on, and that is that the senator who brought this bill, probably one of the most diligent senators that we have. When he has a bill, he really works on it, and he does a really good job. And this is one where there is controversy on it, and I think the path that the vice chair is leading us to is the correct path. Thank you.
Mr.
Thank
Chair.
you. Go ahead.
I'd like to bring a secondary motion.
Substitute motion?
Substitute motion of due pass.
Okay. Senator Groves offers a substitute motion and due pass on 211E. Do we have a second?
Second.
Okay, thank you. Senator Voigt seconds. And discussion on that motion.
Well, the reason why I'm bringing that is because I think we're comparing like apples and oranges. We had the other day where I specifically said I felt like I was in a custody child suit, and this is different. The other day we were talking about hospitals and whatever, and they had lots of money and lots of attorneys, and they could fight it out. This is a very different thing. Our emergency services are not essential services. They do not have the money that the hospitals have, that the insurance companies have. You have an entity that has insureds who are paying their premiums every single month, and they're paying those premiums for the worst case scenario. If the worst thing goes down, they want insurance, and they want that insurance to pay their bills. These people who are sitting here are saying, we're here 24/7. We're coming for you, and we're not asking if you have insurance. And in fact, we might even be assuming that you don't. But they're coming anyway. And so they're partnering alongside of this insurance company who is consistently getting paid, and these guys are not getting paid. And so I feel like we have had a lot of conversation in our previous task force. I don't think that we have to keep having task forces in order to start making some decisions. And so I don't know if this is the right bill or not. I think it just moves this thing down the line, and it starts putting some potential money in the hands of these people. We're going to lose our services. And so I think that we're in a dire situation. I think we need to stand with these guys and give them the funding that they need. And I would just ask you to support the do pass. Thank you.
Thank you. Any other comments on the motion? Senator Voigt.
Thank you, Mr. Chairman. My concern is 41st day, and then the language of the act right now in terms of the one verb, establish. That means you will do it. My concern is 41st day. It's too gray for me. I think we need to put it seriously, and that word establish means we need to do something.
Any other comments? I'll make one quickly here. I'm going to support the do pass motion. We don't have any idea if we will have a task force or not, if Senate Bill 89 will move forward. And if it doesn't, we're going to be stuck here for another year, have the same discussion next year. I truly do believe that our ambulance services are critical, and they need to be funded. And I think this is a good answer, at least a good starting point. So I will support the motion. So with that, I'll ask the Secretary to call the roll for the do pass motions by Senator Grove on Senate Bill 211E as amended and seconded by Senator Voigt.
Senator Grove.
Aye.
Perry.
No.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
No.
Jensen.
Aye.
Mr. Chair, we have 5 yeas and 2 nays.
Okay. Thank you. Senate Bill 211E as amended will move to the floor with a do pass recommendation. Okay, we'll move on to the next bill now. We have time, but not a lot. So we'll move to Senate Bill 221, establish requirements for the distribution and sale of vapor products and to provide a penalty therefore. Do we have any proponent testimony? Good morning and thank you.
Good morning, Mr. Chair. My name is Chris Carr. I'm a senator from District 11, and I bring to you Senate Bill 221. I have an amendment. It's 221A that I'd ask the committee move on my behalf.
So moved.
Second.
Okay. Senator Perry moves to accept the amendment 221A, seconded by Senator Davis. All those in favor say aye. Aye. Opposed, nay. Thank you. Please present your bill.
Thank you again. Good morning, committee. Thank you for moving that amendment. That amendment is a rather large red amendment known as basically a hog house, and it came out last night. So I'm going to do my best to cover what's in here. There's others that also can speak to some of the technical pieces. This is a work product that started last year through the summer, meeting with different stakeholders to come up with this language. I think it's a pretty good, solid structure for what we need to do. So what we're dealing with right now is not traditional tobacco. Over 2 million youth nationwide use e-cigarettes. We're dealing with an unregulated nicotine delivery market that has evolved faster than our statutes have kept up. Disposable vape market has exploded with minimal oversight. So here's the issues we're dealing with. We have synthetic nicotine bypassed federal tobacco classification loopholes. We have retail compliance that's inconsistent. We have enforcement funding that's currently limited. This bill helps establish structure, accountability, and enforcement where today there is inconsistency. Under this framework, any retailer selling nicotine products must be licensed through the Department of Revenue, and that means transparency, that means inspections, and that means consequences. I'll get into the meat of the bill a little bit. This creates a tiered licensing rationale. High-volume vape shops pose greater compliance risks. So there's a Tier 1 for your vape and specialty shops with a $500 license fee. Tier 2 is your general retailers that have these nicotine products. That has a $250 license fee. I think this aligns enforcement costs with risk exposure. Creates fairness across these retailer types. Let's talk enforcement. This requires a 24-month inspection minimum, so at least once in every 24 months there will be an inspection. Re-inspections are within 6 months after a violation. There's escalating fine structure, so let's talk about those teeth a little bit. There's 30-day suspension on a third violation. There's revocation on fourth violation, $5,000 per day for unlicensed sales, and public posting of violations. Youth protection provisions are in this bill as well. There's 1,000-foot school buffer. This does not allow vending machine sales, online or app-based sales. Requires mandatory signage. Says there's no free samples, and there's no sales under the age of 21. Some key takeaways, I think, here for you to think about. I think about economics and market fairness, and I think I made that clear in the conversations over the last year. I think this protects law-abiding retailers. I think it creates clear regulatory framework. It has a dedicated enforcement fund, and there's transparency through public license registry. With that, I'll stand by for questions. I know there's others that want to testify. Thank you.
Thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. Jennifer Stalling. I'm here on behalf of the American Heart Association and the South Dakota Nurses Association, and just would start by thanking Senator Carr and all of the different stakeholders who have continued this conversation throughout session, and as he had indicated earlier this year when we started these first discussions. So just by way of a quick public health background to add to what the sponsor said, nearly 25% of the high school students in South Dakota are using at least one of the products that's impacted by this bill. So what we're talking about is making sure that anyone who is selling nicotine products has a license that the state can look at and take action on if we find that that retailer is not complying with the requirements of Senate Bill 221 as it's amended. Despite the fact that these products are already required to be sold only to people who are 21 and over. So at the end of the day, they're 21 and over products, but we are seeing our youth have access to them, and we are seeing our youth use them. What Senate Bill 221 does from the public health perspective is it really levels the playing field. Right now, there are a number of regulations that apply only to tobacco products and cigarettes. That has come through a long-standing tradition in this legislature. As you've looked at that, many of you have been involved in the regulation of that. But as the senator said, vape has been an emerging product that has come onto the market. What we're looking to do is to treat these products the same for purposes of retail licensing, and that's what Senate Bill 221 does. What's most important to us from a public health standpoint is really in Section 9, where we lay out what a licensee can and cannot do as far as how that product can be sold or shipped, or who it can be sold to. Can't be sold through vending machines, can't be sold through over-the-phone sales, can't be free samples, for example. And then you juxtapose that with Section 15, which, as the senator pointed out, has a series of graduated fines and penalties so that there's some enforcement. Right now, our current law doesn't have a significant enforcement structure for how we deal with violations of the under 21 age. The other thing that it does is it's an effective tool to make sure that we don't get these products into kids who are less than 21 for use, because we know if you start using before you're the age of 21, that there's a much higher rate or likelihood that you will become a lifetime user of these products. This isn't something that's new. Obviously, the conversations that have been happening over a session have made this unique to South Dakota, and that we've worked with stakeholders to arrive at the version of the bill that you see before you. 41 other states, however, are already licensing retailers of these products. So it's not a new concept. We know it's an effective tool. We know that it can be implemented. We know that it works. In addition to South Dakota, there's also 4 other states that are taking up this topic. So again, we're not reinventing the wheel. I appreciate the conversations that we're having today have made it a South Dakota specific type of bill, but really it's something that we know works. I would just go back and point out specifically to Section 20, we think is very important in this bill. It's a fine structure for someone who's selling without a license. Because again, one of the issues we find in this area is that we don't really know exactly who's selling these products. So we want to, A, require the license of the people who are, and B, have a mechanism to take action against those who are not properly licensed when they are selling the product. I would submit to you that this is, in some ways, the perfect bill, in so much as I don't think anybody who's been involved in those conversations is particularly thrilled about the whole bill. From a public health standpoint, we would certainly like to see higher fees. We would like to see stronger penalties. We would like to see some additional things in the bill. But we understand that to move the ball forward and to have progress, you need to have conversations that make the bill specific to what the stakeholders need. I'm guessing there's some other stakeholders that aren't also happy with all provisions of the bill. And so I would just submit to you, in my experience, that makes a lot of sense that we're moving in the right direction. And so on behalf of the Heart Association and the Nurses Association, we would ask for your support of the bill.
Okay, thank you. Any other proponent testimony?
Good morning, Mr. Chair, members of the committee. My name is Sam Nelson, and I'm a registered lobbyist for the Vapor Technology Association. And what that is it's a national trade organization that was founded in 2015 with the goal of ensuring that our members' legitimate products maintain market access and at the same time preventing youth access to these products. As you may know, the age to purchase these products is 21 now, and VTA was instrumental in ensuring and working with the Trump administration and others to raise the age for the purchase of these products. We understand the concerns that our friends in healthcare and others have with these products. We understand the intent of the bill. Particularly Section 9, we want to ensure that the state knows who is selling these products, that they are appropriately regulated, and that people who are selling them to kids or anybody that shouldn't be getting them are appropriately punished. And so this licensure regime in Senate Bill 221 does that. As you know, there's another bill, House Bill 1220, which is also progressing through the system, which regulates folks at the wholesale level. So we support both of those bills, and we urge your passage of this. Thank you.
Thank you. Any other proponent testimony in the room? I know, is Ms. Kennecke online? Angela Kennecke, are you online?
Yes.
And,
Yes,
go ahead
yes,
and
I am.
introduce yourself and begin. Thank you.
Sure. Thank you, Chairman and members of the committee. And thank you for the opportunity to speak today on behalf of the Emily's Hope Youth Prevention Coalition. Our coalition includes educators, prevention professionals, parents, students, and school resource officers. We all see firsthand how nicotine and the related products are affecting young people in South Dakota. And as part of our work, we examined vape shop locations near schools in our 2 largest communities. What we found is a concern. In Sioux Falls, we identified 5 vape shops located within a quarter-mile of a school. In Rapid City, we found 6 vape shops within that same distance. And that's not a trivial number because closeness really matters. Repeated exposure to retail environments centered on addictive products really normalizes them. Kids also have curiosity, and they seem really accessible among our youth. And this is well established in prevention research and minors and mirrors actually what schools report every single day. And you'll probably remember this year the Attorney General's office conducted a sting on 5 different vape shops and found both illegal and dangerous products in all 5 of them. And that's something that just simply cannot be ignored. So we need to do more as a state to make sure that these products are not falling into the hands of our kids. Every day we hear about vaping that goes on in our schools. We have a school resource officer as part of our coalition who told us just yesterday day that THC pouches are now being found in schools. Kids are mixing those with water. THC pouches are often sold at vape shops, even if they're not supposed to be. So this is really an industry that has just exploded overnight, and we have not gotten our arms wrapped around it. We don't have a handle on it. And that's what we need to do to really protect our young people. The retailers who are doing an honest business out there, who are selling products that don't appeal to kids, who are selling the non-flavored products and who are only selling to adults, are doing it the right way. And they shouldn't fear this kind of legislation. They should welcome it. And I think we heard that in the last proponent testimony. So I think we just need to move forward with doing what's best for the kids of South Dakota in terms of prevention. We know nicotine is a highly addictive substance, and we don't want kids using it before their brains are fully developed. So I urge you to pass this bill. Thank you very much.
Okay, thank you. Do we have any other proponent testimony? Okay, seeing none, we'll move to opponent testimony. Mr. Mason, do you want to start off? Okay, thank you. Good morning.
Morning, Chair, members of the committee. Name's Jordan Mason with South Dakota Retailers for Better Alternatives. While we support the shared goal of preventing youth access to nicotine, this legislation as drafted is overreaching. It's definitely legally vulnerable and economically destructive. And while we look forward to the opportunity to work with the prime sponsor on any sort of amendments, we do have some fairly serious and grave concerns. Before we dive into the specifics of SB 221A as it's amended, I do want to point out some simple ideas and concepts real quick. First, I think everyone here, common sense, would agree that a pencil is not the same as a tree, even though both contain wood. And I would like to just lay out this concept that nicotine naturally occurs, and while vaping may contain nicotine, it is not the same as a cigarette. Those are two distinctly different things. And that seems to be getting confused during this conversation. Now, vaping has been the #1 method worldwide to help people quit smoking. It's one of the facts that a lot of people don't want to talk about, but it's true. It's a free market solution to an ongoing problem. Now, this is why I'm here, to try to advance a regulatory framework to preserve something that will preserve the lives of people that are addicted to tobacco, while also keeping it out of the hands of the youth. Now, the definition, and let's jump into this. Section 2, subdivision 2, this is frankly a classic vagueness doctrine problem. And let me be specific. It states to mimic or replicate the pharmacological effects of nicotine. So in other words, this bill risks pulling completely unrelated products into the restrictive tax and licensing regime. Under this broad language, alkaloid-based stimulant blends, future non-nicotine inhalable technologies, or even concentrated caffeine pouches and botanical supplements could be captured simply because they provide similar stimulant effects. Now, if a clerk sells a high caffeine energy product or drink, then a regular may recognize that that mimics nicotine and its pharmacological effects. That business is suddenly in violation of the law they didn't even know they were under. Now, even more, let's talk about this phrase where it says delivery systems, components, parts, or accessories. Now we're talking about batteries. We're talking about wires. We're talking about things with zero nicotine in them at all. And they're suddenly subject to the same strict zoning and regulations, including up to a $5,000 fine under this law. Now, I want to go even further and just point out that under Section 8, this is frankly where we are frankly just offended. Now, under South Dakota Codified Law 2224B-22, sex offenders are required to stay 500 feet away from school. Your businesses and your communities should not be treated like sex offenders. That's inappropriate. Moving on, I would like to just point out that in talking about that zoning regulation, alcohol itself, according to the Department of Health, has roughly 365 deaths per year. We don't, as a state, require alcohol to be 500 feet from a school. This is totally unparalleled as a precedent in the state of South Dakota. And again, it's offensive. I would also just point out, under MG Oil, the South Dakota Supreme Court, under MG Oil versus City of Rapid City, also found similar zoning restrictions to be, quote, unreasonable, arbitrary, and capricious. And I will also quote part of their opinion, it was an abuse of discretion. The issue came up when the city of Rapid City tried to impose extreme buffers while ignoring vastly higher mortality rates from other substances. That's the very definition of arbitrary and capricious. Now, the reality is this is targeting an industry that serves as a harm reduction tool for adults while it treats the shops that serve them like sex offenders. That's inappropriate. Section 9, subdivisions 3 and 4 represent a direct assault on modern commerce. The reality is the internet is a thing, it's not going away, and unless the state can show that those methods do not comply with the safety requirements to keep this out of youth access, we're simply assaulting business methods. In addition, that's actually restricted and regulated under the PACT Act under federal law. Excuse me. Finally, we want to touch on Section 9 as well, where it says it's capable of. The reality is any programmable chip of any kind, including a calculator, could be programmable and is capable of having a game on it. Now, I just want to be clear, that's a trap for retailers who have no ability to audit the theoretical programming capacity of a microchip. This is like banning the sale of a modern toaster because someone could technically hack the display to play a game. Or even more simply, to give you an analogy, that's like banning a pickup truck because it is capable of driving through a playground. We punish the illegal action. We don't ban the tool. To penalize a retailer because a chipset has the latent capacity for interaction is a standard that no business can reasonably meet. Finally, members of the committee, SB 221, as stated earlier, is a retread of something that was hog-housed in the House because it was unworkable. So we would ask you to, at a minimum, consider not passing this or pass it without recommendation. Thank you.
Okay, thank you. Any other opponent testimony in the room? Good morning.
Good morning, Mr. Chairman, members of the committee. Bill Van Camp, I'm an attorney from Pierre, and I'm a registered lobbyist for the original South Dakota Retailers Association that was established in 1887 and has been here ever since in this building. Well, this building didn't get built then, so it would have been about 20 years after that, sorry. You know, as I looked at this bill and we opposed House Bill 1240 on the House side, and we did not oppose House Bill 1220 as it was amended, I'm struck by the fact, and the proponents of the bill acknowledged that the law is already that these products can't be sold to anyone who's under 21. I mean, that's the law now. So I was Googling around this morning, which is always dangerous, and I was reading an FDA release in April of last year that was sent to retail establishments as they fined a number of establishments and sent warning letters as it related to the selling of Zins, which is a product my 24-year-olds love, and I wish they didn't, but they do. And it said it is illegal, this is in the FDA's press release, it is illegal for a retailer to sell any tobacco products, which includes cigarettes, e-cigarettes, cigars, and nicotine pouches, to anyone under 21. This federal minimum age of sale applies to all retail establishments and persons with no exceptions. So what are we doing here? Really? We're creating another regulatory environment for businesses in South Dakota that choose to sell legal products, and we're foisting a fee upon them. And they might argue it's only $250 for the mom and pop, gas station in Groton versus $500 for a tobacco shop in Aberdeen. But it's still an additional regulatory item that they need to comply with, and they need to produce a application with the department, and they need to annually comply with that. What's going on right now in law in South Dakota? Well, retailers have to register when they pick up their sales and use tax to conduct business in South Dakota. They need to inform the department that they're selling tobacco. What else do they have to do? They have to only sell certified brands of cigarettes. They have to ensure that every pack of cigarettes is marked with a South Dakota tax stamp. They need to purchase those products only from distributors and wholesalers that are licensed in the state of South Dakota. 1220, which is the bill that passed out of the House yesterday, I think, will require the same thing for vape products or nicotine pouches. We can't ship directly to consumers, and we have to follow pricing rules and packaging laws. Of course, we can't sell to anyone under 21. Okay, that's fine. And we comply with that. If we don't, we should be fined.
We should be subject to our licenses, our sales and use tax licenses being subject to, legal jeopardy. We don't object to that. We want to do honest business as allowed in the state of South Dakota and sell products that are legal. When you look at the definition, though, and if I'm wrong on this, I wish somebody would come up here and tell me I'm wrong, but all tobacco necessarily contains nicotine. It's a naturally occurring part of the tobacco plant. And this says that the term for a nicotine product does not include any food, drug, device, or combination of products. I think that's meant to pick up smoking cessation products, but I think this would require a retailer who is selling strictly tobacco, chewing tobacco, cigarettes, something they might have been doing for the last 50, 75 years, who knows how long, without having to pay an annual fee, without having to file a license, and without being subject to those burdens, to now pick up a license to sell products they've been selling in their stores for decades. And for that reason alone, we think this is unnecessary. It is the law. We can't sell these products. If they want to do some definitional work, that's fine, but we don't think the retailer should have to pick up the fee for this, and the retailer shouldn't have to go through the regulatory hurdles to be licensed to sell a product. In many instances, they've been selling for decades already. Thank you.
Thank you. Do we have any other opponent testimony in the room? We have one online that I know of, maybe. Are you an opponent? Okay, we'll go to Mr. Rose. Are you online right now?
Yes.
Yep. Go ahead. We're up against the clock again, and we got about 4 or 5 minutes left, so go ahead and begin your testimony.
Yeah, Mr. Chair, respectable members of the committee, my name is Caleb Rose.
If you can hear me, you froze up. There you go. Okay.
Oh. So two vape stores. We've sold vapor products since 2013. Many of my concerns have been cited specifically. So, and I understand that the prime sponsor is going to be willing to work with us in the future. So I'm here opposing primarily due to the last minute nature of the bill. And to be honest, as a retailer, this bill arguably could stand to benefit me. It substantially reduces the amount of competition and affects areas I don't do business in. The fines, though higher than they should be, and I can manage the amount of protectionism, the amount of protectionism in this bill would probably pay for it even. However, it does concern me that it seems to be the rhetoric is to treat vaping the same as cigarettes. We are in this business for harm reduction. That's what we're all about, is getting people to quit smoking cigarettes. The bottom line is vaping continues to be the best way to get folks off cigarettes, and it continues to show no harm. When laws punish people for using an effective alternative to cigarettes and tobacco, they inevitably lead more nicotine users back to those harmful delivery methods. Vaping is and always has been about harm reduction. I'd like to make sure these bills focus on youth vaping and reducing that, and less on demonizing my industry and creating unintended consequences that are going to drive my customers back to cigarettes. As an example, I don't ship vapor products, but I still believe that my customers should be able to order them. I don't have vending machines, but I would still like smokers to be able to get a vapor product from a vending machine if it's going to help them quit. So I do appreciate the intentions of this bill, and I do see a lot of ways to amend the concerns that have been previously mentioned by the South Dakota Retailers for Better Alternatives. I need to show up in opposition today based on those reasons. And I thank you for your time, and I'm open to any questions.
Okay, thank you. Probably have time for one more. I think that's all we have, if I looking correctly, or nobody else has come forward. So go ahead and introduce yourself. Thank you.
Mr. Chair, members of the committee, my name is Jason Evans. I'm with the South Dakota Department of Revenue, and I hope I'm not taking anybody's time, because I registered this morning not as a proponent or as an opponent, but rather would like to make some just neutral comments if I could. Just looking at the bill this morning, again, it's a Hog House amendment that I just saw this morning. There's a lot of regulatory actions we're being added here in this space of nicotine products, and you heard some of the opponents talk about some of these products already being sold upheld in the state by retailers for many years. But as I look at this, there's pretty substantial, background checks for the issuance of the license. We're somehow determining property boundaries to ensure they meet that. We're looking at signage, proper text height, if they're in the point of sale system. We're looking at biannual inspections of hundreds, perhaps thousands of retail establishments, and exactly what that means, I'm not exactly clear, but if we're looking at everything related to this bill, we would be doing some type of age verification check as well as all of these other things that you see. We see publications that we're maintaining on our website, taking enforcement actions such as issuing penalties, suspending licenses, issuing revocations, and so a lot of that is going to fall on the Department of Revenue, and I just wanted to make note that that's going to require pretty substantial adequate resources to properly administer this bill. And I do recognize and appreciate that Section 21 creates a new fund and puts the license fees in that fund to help defray those expenses. The million-dollar question is whether or not the $250 license or even $500 license is enough for us to adequately staff up, for us to adequately, amend our systems to accommodate these new licenses and actions that we're needing to do. And again, I want to be on record. The department is not opposed to sensible and responsible regulation in the space. And in fact, we supported a bill last year that would do this very thing, and we're neutral on the 1220 bill that you've heard about earlier. And so we're not opposed to necessarily creating some regulation in the space. Just want to be on record that it's not free. It costs money, and we don't have the current adequate resources to do this. So make sure that we've got the staffing and the resources to take care of it, and we'll do whatever the legislature asks us to do. Thank you very much.
Okay, thank you. With that, I'll offer time for rebuttal. Thank you, Senator.
Oh, good morning. Senator Chris Carr, District 11. Does that mean you buy us all something? Blizzards. Okay. Senator Chris Carr, District 11. Thanks for the discussion on 221. I think this is an incredibly important bill. I want to just start by saying something as sitting here thinking, I think I misspoke, and I want to always correct that. I think I originally said it's 1,000 feet from school when I was giving you the initial information. This bill says 500 feet from school because that's what the current law for tobacco is. Okay, so that's where that comes from. There was some free market and health benefit concerns. We're not really wading into the debate on the health policy of vape, but what we do know and what we heard is some of the industry proponents of the industry want folks to quit smoking cigarettes, want them to vape more. But what we also have heard and what we do know is that there's product safety issues. We heard Ms. Kennecke talk about, 5 of these establishments were inspected. All 5 had products that were unsafe. So that's why we're doing this. That's what we're talking about. I don't normally bring up other bills during a bill testimony, but since 1220 was brought up, I'd ask for a little leeway just to discuss that. In working with Representative Mulder, who also has an interest and a passion for enforcement, we've worked together to figure out what can we do, what do we need to do. Can this all be in one bill or two bills? I think the 2 bills together marriage and complement each other as far as that bill looks at the wholesale and distribution. This bill looks at the retail and some of the consumer safety things that we've talked about this morning. I think lastly, I just want to touch on, there was a comment about some regulatory concerns and current laws. This does reinforce current laws. But here's the issue, again, talking about, we know there's unsafe products, we know there's concerns with the products out on the market. We need to have the ability to inspect. We need to have funding for compliance and compliance enforcement. So this addresses that. And we just heard from the Department of Revenue. The one thing I don't want to do, being a former appropriator, is not figure out how we pay for something and tell you that we need to do something or mandate that we utilize resources that were meant for something else. So that's why this fee exists. Based on the estimates of the number of vape shops and retailers carrying these products, this will generate, I think, between $400,000 and $650,000. So that allows the Department of Revenue to hire, I would say, a couple, maybe 3 individuals that can help carry out this process to make sure that we have compliance and enforcement. Because if we don't have teeth and we don't have enforcement, what good is all this work and effort that we're putting out here? I'll stand by for questions, and thank you for your consideration.
Okay, thank you. With that, I would open it up to committee questions. Senator Reed.
Thank you, Mr. Chair. Maybe for Ms. Dolly. Section 9, item 7, starts on line 7 too. Does this come from the organizations that you represent? Is it something that you've advocated for? I guess would be the first question.
Mr. Chairman, Jennifer Staley on behalf of the Heart Association and the Nurses Association. Senator Reed, that was not included in the original House Bill 1220. I would tell you that we certainly support that we are reducing things that incentivize people to use the vape device. My understanding is, and the sponsor may have more of an answer to that, is there are vaping devices that encourage you to take more vape in so that you get prizes and you get some sort of stimulation in that way, which is clearly aimed at children.
Thank you.
Any other questions? Senator Perry?
Jen, you just well stated. Thank you. And this could be for the proponent or for the opponent, but the big thing is, at one point, one of the opponents said something that that vaping is used to take care of smoking, help with that, and that there wouldn't be the risk with vaping that there would be with smoking. Do you know the risk of vaping, or would you like to share that?
Mr. Chairman, Senator Perry, we would disagree, and I guess didn't come prepared to debate the public health policy of these particular products. We would disagree that vape is a healthier alternative, a harm reduction in a public health sense. What we would advocate in this bill is that these products be treated the same for a retail licensing perspective. But no, I would have to respectfully disagree with Mr. Rose and Mr. Mason. We do not see vape as some healthy alternative to cigarettes. They both have health implications that are fairly serious. The difference is that, quite honestly, tobacco's been around for a very long time. We all know, and the state benefits from the tobacco settlement agreement that happened decades ago because of the science that showed how bad cigarettes and tobacco is for you. I would expect that somewhere in the future we may be seeing science that starts to bear out some of the very negative health effects of vape. So that's a position we just would disagree with. But I think for purposes of this bill, the important thing is that we're treating these products the same, we're enforcing them the same, and we're understanding where they're being sold and how they're being sold.
Okay. Thank you. Any other questions from the committee? Senator Reed?
Thank you, Mr. Chair. Maybe for the prime, and if not, I can always call a friend. Page 8, it's section 22, and it comes out of 34-46-2, and it says the following actions are unlawful. And I think you've done some changes that needed to be made, but you struck number 2, and I'm wondering, number 1, am I reading this correctly? Which I read it as, if I'm under 21 and I try to buy it, if that line, it's been struck, but if that line stays in, and I'm under 21 and I buy it, I have broken the law. Is that a correct interpretation of that unstruck from the language?
I'm going to phone a friend. Thank you. I'm going to phone Ms. Staley.
Mr. Chairman, Jennifer Staley. Senator Reed, I think this perhaps, and thank you for the question, I think it might go to the question of why we need enforcement on both cigarettes and on vape, to Mr. Van Camp's earlier part. So right now, how we enforce the underage sale of tobacco is to punish the child. We don't punish the person who sold it to them. So what we found in other states, the effective way to use tobacco retail licensing is to hold accountable the person that's making the sale. I think there might be another chapter that talks about the underage person making that purchase. But really, for purposes of the retail licensing establishment, it should be the establishment that sells the product to the child, not the person who purchases it. So we're decriminalizing, if you will, the underage purchase.
Thank you.
Okay, thank you. Any other questions, committee? Okay, seeing none, we'll close testimony and open it up to committee action and/or discussion.
Mr. Chair,
Senator Davis.
I would like to move Senate Bill 221 down to the floor with the due pass recommendation.
Do pass, right?
Yes.
So Senator Davis moves Senate Bill 221 as amended. Do pass, seconded by Representative Reed. Sorry, been a long day already. Senator Reed, I spent 6 years in the House doing this, so once in a while the brain flips a little bit. But okay, so any discussion on the motion?
Yes, Mr. Chair, thanks. I care a lot about this issue, and I know the sponsors know that too, and the stakeholders in the room. I'm glad to see something come together that's going to help with some regulation. I think these are very reasonable guardrails to put in place that really mirror the other products that are causing similar harm. And so I don't think it's unreasonable. I think these are very reasonable guardrails. And so we just want to thank the sponsor and the stakeholders for working together to come up with this language. Thank you.
Thank you. Any other discussion? Yep. Go ahead.
Thank you, Mr. Chair. And I served with you first as a representative, so that's okay. And the previous speaker talked about this well. We really are talking about public health here. And I want to thank Ms. Staley for the answer about the gaming, because at first I'm thinking, well, if you're 21, you can do what you want to do, but the whole concept that it's rewarding you with vape for winning, and so I know there's a lot of different things in here that you can probably pick apart, but we got to get started with it. I think we have to start figuring out how we reduce this, and so there may be some things that need to change as this moves through the system, but I think it's the important bill to get the bill started. And just one other comment, I understand, talking about that it can help somebody that's addicted to nicotine and cigarettes, and maybe vape is a way, of lessening some of that. But this bill doesn't stop a 21-year-old from doing that in any way. And it may cause you have to travel a little farther to find it. But I think it's that overall public health is more important. So that's why I support the do pass motion.
Okay, thank you. I'll just make a comment too. I'm going to support the motion. The thing about the establishments, it appears it would only be new establishments after July 1st of 2026 that would be regulated to the 500 feet, so it would not affect any establishment currently in place. So I will support this. And any other comments? Senator Perry.
Thank you. We've been working on vape administration or vape products. We go back in 2018 or 19 when we changed the age to 21. And Angela Kinnecke featured it on one of her presentations on the news. It's something that really touches home with a lot of people. This is a good bill. It's moving in the right direction. We thank you. Thank the Prime for bringing it.
Okay, any other discussion? So Senator Davis moves Senate Bill 211 as amended, a do pass recommendation, seconded by Senator Reed. All those in favor say aye. Opposed, nay. Secretary, please call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay. Thank you. So Senate Bill 211 as amended moves to the floor with a do pass recommendation. Can I get a motion to adjourn?
Second.
Senator Perry moves to adjourn, seconded by Senator Reed. All those in favor say aye. Aye. Opposed, nay. We are adjourned. Thank you.
South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB.